how to actually build yourself, get yourself ready to actually face it positively.
Okay, how it happens, how can we prevent it? I think prevention will be really the main key things, yeah.
Perhaps how to have a better lifestyle in order to prevent it if it's possible.
I think knowing my risk, the possibility of me contracting breast cancer, I think to me, I would like to know more about that.
For breast cancer, I think, maybe prevention. How can we prevent it? I think as early ages of girls, what can they do to prevent it as they grow older and all? And how can they share with other people as well?
Now, those were the answers to our question, what would you like to find out about breast cancer? And there seem to be some who are still unaware of cancer risk. Now, earlier this year in February, Hospital Raja Perempuan Zainab has detected breast cancer in a 6-year-old girl. Now, she was diagnosed with a lump measuring about 2 centimeters on her breast/chest in October. Now, she had had an operation for that lump to be removed. And this goes to show that anyone can be afflicted with cancer, regardless of age. Now, before I welcome our panel of interviewees, let's take a look at the statistics that we have compiled now of breast cancer prevalence, not just in Malaysia, but also globally. So we have just seen some statistics there. Now, I also have a panel of guests here with me to talk more on this topic. Let me just welcome Dr. Santri Somasundram, who is the President and Medical Director of National Cancer Society in Malaysia. We also have Mariati Legori Ibrahim, COO of Pantai Hospital Klang. Now, and also TV personality and celebrity voice of Pink Charity Run 2014, Marion Counter.
Hi there.
Hi, good morning and welcome to Bella, ladies.
Thank you.
Yeah. Now, we've just seen some statistics about breast cancer prevalence, records of about, 3,242 females here being diagnosed. That was in 2007. Now, is there any latest statistics that we have?
The latest statistics that we have is actually from WHO, the GloboCan project, which is 2012. So for Malaysia, for 2012, we're looking at about 5,410 women getting breast cancer in 2012. Now, in terms of percentage-wise, it's about the same. It roughly works out to be about 30% of all women's cancers.
Okay, all right.
So there's not a marked increase in terms of numbers. It's just that our population is also growing in that sense. So your risk of developing breast cancer is, a lifetime risk is 1 in 20 women.
Okay.
So if you put 20 women in a room, 1 by the age of 75 would develop breast cancer. You compare that to a developed country, say Australia or the States, their risk is 1 in 8 or 1 in 9.
Wow.
So our risk is much less, but as we become more developed, it will increase with time as well.
I see, okay. Now there's also reports there that show that breast cancer seems to be higher in the Malays as opposed to in the Chinese group more than the Malay and the Indians. Now, is there any justification or reasoning behind this?
I think really, generally across board between the 3 ethnic groups, all cancers, there's a slight higher increase in Chinese in most cancers.
Okay.
Whether that is because they get cancer more often or whether or not because they come for checkups.
Right.
And so they are diagnosed more than Indians and Malays.
Okay.
We're not sure which one that is or whether it's a combination of both factors.
Right. Because what was going through my mind, could it be a dietary thing or could it be a lifestyle choice? Okay. Now also breast cancer survival rates, because detection, I don't know how aware people are, because we're seeing this increase, although you're saying it's not marked increase here. But again, with breast cancer, it's more prevalent among the 50 age group, 50 years old and above, but also in the below 40 years old, they seem to be an increase globally. How would you explain this?
Basically, in Malaysia, actually that 50 to 59 is not quite true.
Okay.
Compared to Asian countries and Caucasian, breast cancer happens at a younger age in Asian women.
Okay.
So for Malaysia, actually, our peak is between the ages of 40 and 59. So you're looking at 60% of breast cancer happening before the age of 59 years old.
Right.
Compared to, say, in a Caucasian country where most of it happens after menopause. So for Malaysia, I think we see a lot of women between the ages of 35 onwards developing breast cancer. And we have two peaks. We have a peak in the 40s and a slight peak in the 50s as well.
Okay, right.
So they're slightly different in terms of demographics.
Right, okay, okay. Now, Mariati, you know, being the CEO of Pantai Hospital Klang, seeing different types of women coming in, you know, different forms of breast cancer, perhaps you can share your observation with the hospital and the patients that you're receiving.
Okay, mostly patients that we receive is either early stages or is already late stages.
Okay.
You know, basically it comes from because our hospital is from Klang, you know, Pantai Hospital Klang, where we are in a suburban area comparing to urban area. Maybe like the Chinese from the urbans are more educated. They are more aware.
Okay.
So in suburban areas like our areas, you know, mostly they will come at quite a late stage.
Right. Okay.
So that is what my observation is. Then they will have to go for a longer treatment and mostly high risk treatments. That's what I observe for those patients coming to my hospital.
Right. Now, Marian, your story here now are you kind of close, you know, to this disease, you know, within like family or loved ones or people that you know?
I mean, I think in general now you don't just read about cancer anymore, you know, but we all have a family member or a friend who has cancer, is battling cancer or has passed away from cancer. I personally, no family members. In fact, my late dad passed away from cancer. My father-in-law did, and my mom-in-law is currently a breast cancer survivor. She has been for many years. So this cause is definitely something very close to home. It's close to my heart. So when they approached me, Pantai Hospital Klang, to be part of this, I was like, without a doubt, any way I can help. If I can help one person, you know, save one person's life today. I mean, after this interview, maybe someone goes and makes a doctor's appointment tomorrow.
Yes.
I would have done my part. So any way I can help you know, just creating awareness and early detection, I think, is key, really.
Yep. Sure. Yeah. Yeah. Well, we're going to talk more on breast cancer here on Bella Society. Now, don't go anywhere because we'll come back after this break. Welcome back to Bella Society. Now, today we're talking about breast cancer and its prevalence and why every year it keeps increasing. I have with me here three beautiful ladies here. Now, also, we just heard Marian Counter describing how close cancer is to you and your family. Just being a modern woman, Marian, you know, and just knowing how you have seen, obviously, how your family members kind of go through that period. Is there any changes, a wake-up call perhaps for you to make some...
I mean, like I said, my late dad passed away from cancer. And I mean, immediately, you immediately grow up after something like that. And you start realizing that all the little things really don't matter anymore. And living life to the fullest. And you never really understand that until you go through something as intense as that. And just living life to the fullest, loving the people around you wholeheartedly, and of course taking care of yourself and your health and your lifestyle is so important.
And you know, talking about taking care about ourselves, now as women we're always branded to be nurturers because it is kind of instinctual.
Exactly.
And you know, when you are a mother especially, you always put yourself last when it comes to, you know, medical checkups or looking after your medical health. What do you have to say to make women aware today that, you know, taking care of yourself means taking care of your family? I mean, Sathri.
I think for women, as you said, you know, they always put everybody else before them. But yes, the whole idea of taking care of your family is that you have to be there to look after them.
Yes.
And to be there to look after them, you have to look after yourself.
Yes.
And you have to be proactive about yourself. Yes. And we all, you know, bandy this word about early detection, but I think it really, really starts with awareness. To be aware that as a woman, you are at risk. It doesn't matter about your genetic code, it doesn't matter about a lot of other things around, especially for breast cancer where it's more difficult to prevent. As a woman, you're inherently at risk of developing breast cancer, as we all know. We've heard so many people
Yeah,
get
even a
breast
6-year-old girl, you know,
Exactly.
who has it, yes.
So you need to be aware of it. You need to be aware of the signs of it. Because the whole idea of protecting yourself doesn't happen with your doctor. It doesn't happen in a hospital. It happens with you being aware, finding the changes in your breast, and then going into a medical field in that sense and getting the investigations done. But the first step is really about you.
Sure. And when it comes to, expressing the kind of emotions, you know, I suppose when one is diagnosed, I mean, just looking at the hospital that you manage as well, I've just read the story about cancer survivors saying that, you know, when she was first diagnosed, she was being handed lots of information, obviously, you know, saying how to for treatment and how to for diet changes. But all she wanted to do was just go back and scream. I mean, so, you know, just coming from a bureaucrat of a hospital, what do you have to say to people who are first diagnosed or even just kind of battling this at the point of time?
Basically, I can't say not to be scared because it's a scary
experience, right? Yes. I mean, it's life and death sometimes.
Just to hear from the doctor saying that you have breast cancer.
Yeah.
But you basically need a family support here. Okay. And also, like from our hospital, we have a breast care center that we provide some supports to all those affected with breast cancer. Okay, we do have nurses being trained to give advice. So the doctors will refer these patients to the breast care center. And we also work with NCSM and also BCWA to get a psychological support. Okay, other than that, then we try to give them advice, proper advice, you know, and moral supports, not only on medical. You know, we try to assist them. That's how we do in Pantai Hospital Klang.
Right. And for Marian, you know, you are now a mom of 2 girls, right?
I am.
Yeah. So you're juggling motherhood. You're also juggling, you know, a career and also your social life. So a lot of things. I mean, not just, you know, for yourself, but also many other women out there, right? And how would you say women make time at least once a year or whatever it is, once a week to do self-examination?
I mean, I think women, men, everybody, we make too many excuses for everything. I don't have time to find love. I don't have time to hit the gym. I don't have time for this and that. You can make time. You know, really, honestly, everyone and anyone can make time. I just told a friend, you know, who's a little bit unfit, I said, I know you work 9 to 5, sometimes 9 to 9, but if it means getting up at 6 in the morning, or, you know, maybe not going out for that one dinner and coming back and hitting the gym, if that's what it takes, that's what it takes. So like a self-examination, just make time for it. You can make time for anything in the world.
Right.
And like you said, moms always put themselves last. You know what, I've learned to put myself, not first, but as a priority, because, you know, like, you know, you really need to take care of yourself. Sometimes I'm like, you know, 10 minutes, I'd rather spend this time with my girls. I'm like, nope, you are going to the gym. You're going to hit the treadmill, you are going to work those calories off, and just more importantly, you're going to feel healthy. So you can be there for your children. So really, women can make time to take care of themselves.
Yes, you have to, right? Or else it will be your health that will be at risk. And you don't want that to happen. Now, talking about, you know, taking care of ourselves, also medically, there's so many advancements that's been discovered, and aspirin has been widely used for many, many years to prevent heart attacks and strokes, and now aspirin is said to help those with breast cancer. But reports by the British scientists also warns that extended use of aspirin is not suitable for some patients, especially those who are diabetic. Now let's take a look at this story that claims an aspirin a day can keep cancer at bay. So there's still more research that needs to be done to confirm this whole thing about, you know, aspirin keeping cancer at bay. Now back to our guest here. Ladies, now there is this Pink Charity Run 2014 that's coming up, and you are the voice of it, Marion.
Yes, I am.
Yes. So is there any part that you would like to get women involved on how to partake?
Yeah, I mean, you sign up and go for the run. It's really as simple as that. But not only is there going to be a run, but at the run there will be a lot of things that will be going on to create more awareness.
Okay.
Yes.
All right. Okay. And from you, Marion?
This is basically a very 4th year in a row that we have done this Pink Charity Run.
Okay.
Okay. And with Marion, who has kindly agreed to join us, become our voice of celebrity voice.
Thank you so much.
Okay, thank you very much, Marion. And I hope that it will create more awareness, as we have seen that there's an increase of awareness to our society, especially communities in Klang, per se.
Yes.
Okay. And every year there's increase of participation, and we are expecting 50% more compared to last year run. So
okay, that's good.
Please, I hope everybody out there come and join us. If not for the run, we also have booth. We also have a show on how to do breast self-examinations.
Right,
you know,
and that is really important. I mean,
yes,
self-check.
Really
because I was just speaking to our makeup artist, and her sister found out that she had breast cancer just one day while showering and while going for a checkup.
Yes.
So she hasn't been doing a self-check for years, and she's in her 40s. So it was devastating. And Dr. Santari, before we let you go, just some words on self-examination here. I mean, how do you do it properly, and what are the tips that we have to constantly be mindful about?
Okay, I think breast self-examination has moved away from the formal aspect of doing it a specific way. It's moved into this whole idea of being breast aware. So knowing how your breast feels at any time. I think as Asian women, we are a little bit shy about, feeling our breasts or talking about our breasts. But we all realize that there are changes which happen to our breasts throughout our menstrual cycle. Before your menses, it might become a little bit swollen and a little bit more tender. After, it becomes softer. So we should recognize these changes, know what our breast feels like before, after your menses. And so then if there are any changes whatsoever, anything which doesn't feel the same as usual, then you can go and see a doctor and say, please check to make sure that there's nothing there.
Yes.
So that's important, being breast aware.
Being breast aware, yes.
And being confident about it, I think, is important. I think a lot of women who come to us say, oh, we don't know how to do it, or we're not sure whether we're doing it right.
Yes.
There's no such thing. Exactly. You have to be confident that you can be just as good as a doctor is in terms of feeling your breast, because it's your breast.
Yes, it is your body. Yes. Thank you so much, ladies, for joining me here and talking about breast cancer awareness, as well as discussing the statistics about prevalence of breast cancer here, not just in Malaysia, but globally. Now, we're going to take a break, and when we return, there will be more about breast cancer. Just a last bit here about mammogram, and this is some sort of advancement digitally to make it more kind of easier, as well as less time consuming for you to do your check.